Individuals have experienced depression and anxiety at some point in their life, especially during COVID-19. Depression is a common mental disorder that is the leading cause of disability worldwide, while anxiety disorders are the most common mental illness in the U.S. During COVID-19, there has been a lot of uncertainty, isolation, and changes. This can trigger mental health problems such as anxiety and depression, which have been prevalent globally during this pandemic. The extension of quarantine and lack of social interactions has contributed to the increase of anxiety and depression. Increasing from 27.8% in 2020, the rate of depression is now about 32.8%, and 1 in every 3 American adults is affected. The groups that are most likely to experience depressive symptoms are those with low income and those who are unmarried. Additionally, about 56% of young adults have reported symptoms of anxiety and/or depressive disorders.
After the recent pandemic, there are more efforts to screen children at schools than adults at work for early diagnosis. There are also more mental self-care opportunities available to the public to prevent depression, mostly at the local or state level. Actions such as establishment of self-help groups, psychopharmacology, psychotherapy are to increase the prevention and treatment levels. Affordable Care Act was one of the most recent federal level efforts to increase access to healthcare for individuals who cannot afford it.
The measurements are useful, but new challenges arise as the mental health of different groups are disproportionately influenced by the pandemic. The prevalence of depression due to COVID-19 is especially high in younger adults, ethnic minorities, essential workers, and unpaid caregivers. Therefore, more community-level efforts, including health communication strategies, should be taken to increase the intervention and prevention efforts targeting at depression among those groups.
The NIH and the CDC present general information about depression, symptoms, signs, and causes of the disease, treatments available, and additional resources. They also explain the different types of depression and potential risk factors. The best way to seek information is from a licensed healthcare provider. The Substance Abuse and Mental Health Services Administration National Helpline also provides information for those facing mental disorders and those looking to help their loved ones by giving referrals to local treatment facilities, support groups, and community-based organizations. People can go to seek care from a licensed physician or mental health professional. For those who cannot see specialty providers, one can reach out to their primary care physician for more information. Hospital level, psychiatric emergency departments also offer services 24/7 for those in crisis and in need of immediate help.
There are several misconceptions surrounding anxiety and depression, a major one being that medication as a treatment for these mental illnesses makes people behave unlike themselves. In reality, it is a safe treatment that is prescribed by healthcare professionals that helps treat symptoms to make people behave like their usual self. To deal with misconceptions as this one, healthcare professionals can start by providing a safe environment for patients to ask questions and educate themselves on the topic. Additionally, healthcare systems can increase mental health education by allocating more resources toward mental health programs in communities, placing an emphasis on depression and anxiety due to their extensive impact.